Hi everyone, my name is Christine Maytalang and I'm from BSN2 of the College of Our Lady of Mount Carmel. And today I'm going to do a return demonstration and a proper way of doing a perineal care or a perineal flush. Okay, so the first thing that we'll have to do is to make sure that we have all of our equipments ready on the bedside. Of course, this is to conserve time and energy. So the things that we will be needing is a pitcher with a lukewarm water, about 300 to 500 ml, about 40.5 to 43.3 degrees Celsius. So we have it here. Sterile cotton balls. I also have one here, 8 cotton balls with betadine solution. We have the betadine solution here, the picking forceps. We also have, of course, our clean gloves, our kidney basin, our bath blanket. We also have here the bedpan. Let's just assume that this is a bedpan. We also have here a waste receptacle, a pail, and at the same time absorbent pad which you already put in here, and at the same time a rubber sheet. Okay, and if you're, for example, in a ward, then you may need a screen for ward use. Okay, so now. By the way, perineal care is a care that we use in we do to thoroughly clean the external genitalia, the anal part, and the surrounding part of a female. Okay, so we normally do this for patients who just gave birth or who is about to give birth or who's in hospital. Okay, this is of course to help them avoid any infections, for us to check as well for any signs of infection, and of course this will also help them freshen up. Okay, so the first thing, or after we've completed all of our equipments, we now formulate our nursing diagnosis. So our nursing diagnosis for this is risk for infection related to improper aseptic technique, and of course our outcome or our desired outcome after the procedures, to make sure that the mother will be free from infection after the delivery. Okay, so after that, of course, it is necessary for us to introduce ourselves to the patient and identify the patient's identity. So, hi ma'am, my name is Christine. I'll be your student nurse for today. Can I please have your name? Thank you po. Can I have your date of birth? Thank you. And is it okay, ma'am, if I'll check your wristband? Thank you so much. So, by the way, ma'am, today we'll be doing a perineal care. So, I'll be exposing your perineal part. We'll be cleaning it. Of course, this is for us to avoid infection, and at the same time, this will also help you to, of course, freshen up. Okay? So, is that okay with you, ma'am? Alright, thank you so much. So, after we've introduced ourselves, identify the patient's identity as well, and explain the procedure, then it is now time for us to, of course, provide privacy. So this is very necessary for us since we will be exposing a very sensitive part of the patient. So if you are in a, let's say, private room, you can just close the door. But if you are in a ward, then it is necessary for you to cover it with, a curtain or a screen, to make sure that you're only exposing the perineal area. Okay, and then after that, after we've basically provide privacy to the patient, we now put the absorbent pad on the bed. Of course, this is for us to avoid wetting the bed. Okay, after we put the absorbent pad, we now ask the patient to go on a dorsal recumbent position, and then we try to insert the bedpan below the buttocks. Okay, ma'am, I may need you po to flex your knees po, like that. Thank you so much po. And I'll be inserting a bedpan po dito po sa ilalim ng bed nyo, para po hindi po mabasa yung bed natin, para po masuportahan po yung water po. Okay. So, nakatog 1, 2, 3, ma'am. Tulungan niyo po ako. Buhatin ko po yung bed nyo. 1, 2, 3. Thank you so much. So after we have done putting the bedpan, it's now time for us to drape the patient using the bath blanket, making sure that you only expose the perineal area. So this is our bath blanket. And then again, we make sure that we only expose the area to be clean or to be washed. So after that, let's go ahead and wash our hands, okay, and then don on clean gloves. So let me just wash my hands. When I'm done washing my hands, let me go ahead and don on gloves, clean gloves. Of course, this is for us to avoid cross-contamination. After we've done on clean gloves, let's go ahead and pour the thigh, inner thigh, and outer thigh of the patient with the lukewarm water. Then after that, we need to go ahead and separate the labia minora and then form or irrigate water from it. Separate, so go ahead and separate the labia with your non-dominant hand. And then form irrigating solution to it. And then after that, we go ahead and cleanse the perineal part using a betadine solution. Cotton balls with a betadine solution. So in cleaning it, we'll be using 8 cotton balls that start with the middle part. So again, from the symphysis pubis going down to the anal part. So let's go ahead and start. And I'll be putting here the kidney basin where I can. So the first thing is of course from here down to here, and then discard. And then next is the labia majora, using the number 7 stroke, and then discard. Next is the next labia majora on the other side, and then you discard. After that, we clean the labia minora up to the anal part, and then we discard. And then the other side of the labia minora. And then after that, we go ahead and clean the thigh, making sure that we don't retract, okay, to avoid, of course, unsterilizing or the already clean one. Then the other part. And then after that, of course, so after we're done cleaning it, we go ahead and of course cleanse the part or rinse the part with the lukewarm water. After we cleanse the patient using a lukewarm water, we now remove the bedpan. After removing the bedpan, we now go ahead and of course wipe the perineal part with the same stroke that we've used when we did, or when a while ago when we did the cleaning. So this is a dry cotton balls. on the middle part, on the labia majora, another labia majora, the labia minora, other labia minora, and then the eye, and then the other side part, and then the 8 cotton balls is going to be in one stream. And then after we've done that, so of course, we need to help the patient do the side lying so we can also clean the anal part. So we ask the patient, ma'am, assist ko lang po kayo mag-side para malinis ko po yung anal part. At least for the anal part, we'll do the same. Still wipe the butt cheeks. And then the other part. Make sure we dry it. And then after that, we help the patient to go on a dorsal position. The next thing we'll do, so discard the soiled water, we clean our equipment, and then of course we also remove our soiled gloves. And of course, remove the absorbent pad. Remove ko lang po ng absorbent pad natin. After we remove the absorbent pad, we now position the patient in a comfortable position and remove the bath blanket. Remove ko na po yung bath blanket niyo. Position the patient in a comfortable position. Comfortable na po ba kayo? Okay na po ba yung position niyo na ganito? Thank you so much po. And then after positioning the patient in a comfortable position, it's now time for you to wash your hands. So I'll go ahead and wash my hands after the procedure. So now after the procedure, of course, you record any significant problems such as redness, any types of excoriation, swelling. And if the patient, for example, just had an episiotomy, it should be noted for edema, any swelling, any separation or presence of hematoma. And it is also necessary for us to note for any presence of secretion, the amount, the color, and the odor of the secretion. And lastly, we document the client's tolerance towards the procedure. So that's it for the perineal care. Thank you so much for watching and I hope you've learned something. Thank you and you have a good day.